The potential for yet more disruption within the NHS. It was the resident doctors, 5 days of strikes just finishing over pay. Now we're talking about the nurses, the Royal College of Nursing saying that a better deal is needed on their profession, investment in their profession over the next couple of months. Otherwise, members will be balloted on strike action. They say that an unprecedented number of nurses, 170,000, came out to vote on a 56% turnout, voting to reject that 3.6% pay offer, 91% of them voting against it. Now, according to the Chief Executive and General Secretary of the Royal College of Nursing, the real problem is that there is a risk of losing experienced staff who are absolutely crucial. This is what Professor Nicola Ranger had to say. My profession feels deeply undervalued, and that is why record numbers are telling the government to wake up, sense the urgency here and do what's right by them and by patients. Long overdue reforms to nursing career progression and the NHS pay structure aren't just about fairness and equity, but are critical for patient safety. To avoid formal escalation, the government must be true to its word and negotiate on reforms of the outdated pay structure, which traps nursing staff at the same band their entire career. Well, the Department of Health has responded as you would expect, and you get a real sense of the frustration from them in this statement. After receiving 2 above-inflation pay rises from this government, new full-time nurses will earn £30,000 in basic pay for the first time this year. So it's disappointing that RCM members are dissatisfied with this year's pay rise. We hugely value the work of nurses, and through our 10-year health plan, we're rebuilding the NHS for the benefit of patients and staff and ensuring nursing remains an attractive career choice. This government is clear we can't move any further on headline pay, but will work with the RCN to improve their major concerns, including pay structure reform, concerns on career progression and wider working conditions. So we know that nurses are prepared to strike. They did in 2022, 2023, unprecedented strikes from the nurses, and the government with a clear deadline. They've been told to come to some acceptable agreement over the summer. Otherwise, nurses will be balloted on strike action.